I just remember 2020 was just hopeless. It was all doom and gloom. We were all locked up. Everyone was scared. COVID was everywhere. And then the start of 2021 did see some hope. And I will always remember that from being when the vaccines became available.
Victoria will be in lockdown within the next 48 hours. Here are the latest developments in the coronavirus crisis.
When I was told that we would be running the vaccination program at the Royal Exhibition Building, it was really daunting. We had already set up a staff clinic to service the hospital, but to then move to community at such a big scale was really overwhelming, to be honest. But then I thought, well, if not us, who?
The state was in trouble, and I just couldn't see how we were going to get out of this unless we just got these vaccines into people and started somewhat of a recovery process that had been such a long year, the year prior, and really no hope. And that was probably the difference for me, is the minute we got into this building, I just felt that there was hope.
We ran for exactly 1 year and 1 day. And over the course of that time, we administered over 400,000 vaccines to Victorians and people of the Melbourne community.
So if you think about that first contact happening in February, and then on the 22nd of March 2021, the doors are open. And that, I think, was quite an amazing feat.
When we first got notice that we could move into the Royal Exhibition Building, we had 5 days to set everything up from scratch. So there was a working bee, everybody came, helped out. I remember on one of the days we were setting up, Angela Nolan, our CEO, was packing rubbish bins. We were all hands on deck just to get it up and running. And really it was, once we started to operate, we realised that this was something we could do. I think all that feeling of being overwhelmed just went away, and then it was just, let's get this job done. Let's do as many as we possibly can.
There was really only one major brief, and that was to get as many vaccines into as many arms as safely as possible. Prevent wastage, which was a really big thing when we couldn't get enough, so every single vaccine counted.
Outside the Royal Exhibition Building, an eager few were lining up to be among the first to be admitted under Victorians' mass vaccination model.
Over the course of the year, at the very peak of the operations here at the Royal Exhibition Buildings, we employed over 600 staff. Some of those staff came from our existing St Vincent's staff members, but we also employed lots of new people. And these were people who, during the pandemic, wanted to be able to contribute to their community.
Before this, I was working in the hospitality industry in a restaurant. So we were stood down because of the second major lockdown in Victoria. This job was offered to me back in October, and that time I was still grieving because my dad passed away because of COVID too. So when I started this, I was so inspired. It's close to my heart because my dad died due to COVID, and I was doing a vaccination to prevent people dying from COVID.
Now, I recently retired about 2 years ago from the public sector, and the opportunity comes around last April. We really want some personnel to help for the vaccination program. So I think it's my duty to get myself engaged again, go back to the community service.
Young Victorians have swamped the state-run vaccination hubs after Pfizer officially became available to 16 to 39-year-olds. Mimi Becker reports.
There were lots of changes to restrictions, there were lots of changes to the eligibility of vaccines, and so the team had to be very flexible and adaptable and be able to spin on a dime, if you like, and really move quite quickly as the situation changed and what was being asked of us changed. At very short notice, we had to move from the Royal Exhibition Building over to the Melbourne Museum for a few weeks while they were doing some restoration work.
Today, we're opening a new temporary facility here at the Museum Victoria.
This building, the Royal Exhibition Building, of course, is in our custodianship. And when it needed repairs, well, We had to then think of an alternative for the vaccination centre. Museum was closed, and it was simply a matter of saying, well, why not just move across the road? I think that was a wonderful experience for people having the vaccinations at that time as well. And it was just good to have the facility, which is owned by the public of Victoria, being used in that way.
When we first came in, it's only vaccinating the healthcare workers only and the emergency service. And so we produce about 400 vaccines, 500 vaccines a day.
There was a day when we had opened up all the eligibility and we had a line all the way down the street. It was about a 6-hour line. Lots of camera crews everywhere, so a lot of pressure. We had all 40 cubicles running. Everyone was under the pump and we were only open for a certain amount of time, and we wanted to get as many of these people through. So everyone was trying their best. There was a bit of sweating, a few tears, but we otherwise got through it, luckily.
There was such a buzz about the place in those busy days with the queues around the building, and again, people were still always, you could see them waiting for hours, and they still were like, oh, you're doing a great job, and we'd be apologising, saying, so sorry you've had to wait. Oh no, it's fine, this is really good, and we're so lucky we live in Australia, and you're just getting positive feedback.
I will remember probably when we reached our 500,000 vaccination mark. That was a huge milestone for us.
Tell me 2 years ago this was what I'd be doing, and I wouldn't believe you.
In terms of personal memories, driving to work feeling like I was a part of something bigger.
People doesn't feel scared, when they're here in this building. They feel relaxed.
A funny memory, or a number of memories that come to mind, are people who are actually quite needle phobic, and then they would expose their arm and they would be covered in tattoos. And I'm thinking, you can sit and have hours on someone, putting a tattoo on, and they're often, big burly men, and often policemen even.
Royal Exhibition Building has such a rich history, including the first opening of the Federal Parliament of Australia in 1901. And then in 1919, it was set up as a hospital when we were contending as a nation with the Spanish flu. And there were over 4,000 people who were hospitalised here during that period.
I wasn't aware of the history when I started working here, that the Royal Exhibition Buildings had been involved with the Spanish flu back in 1919, and I found that out in one of my first days, and I certainly made sure then when I was orientating new staff, I thought it's so important for them to see that this was used as a hospital and to save lives 100 years ago, and now we are still saving lives but in a different way by vaccinating people.
I think it's become such a hub for people, and everybody knows the building, everybody knows where it is, and initially, when people would come in, they would often have memories of exams. A lot of them had sort of post-traumatic memories coming in of having exams in the Royal Exhibition Building, or memories of the garden show, or a beer show, or a bridal show that was here. And now I just think all of these people who've come through, they're going to remember getting their vaccine here, and we were a part of that.
The thing I miss most about the Royal Exhibition Building is the atmosphere. Having so many people here ready to take a jab, ready to take that step for Victoria, having so many staff that are new to nursing, have come out of retirement, have never worked as a nurse before, but have been able to upskill and do this. It has been fantastic.
We've been able to touch people who maybe haven't had an experience with St Vincent's before, and to come here and to be cared for in a way that's, quite important at this point in time for humanity, was such a privilege for us to be of service to our community. And we've got a long and proud history of serving our community. So to be able to do that at this point in time is a great moment of pride for us, but also a privilege.
Good evening. Precious Freedoms will return at midnight when lockdown 5 officially ends.
We just hopefully helped people stop getting sick, stop, catching COVID, stopped having to go to hospital, help people be able to get their lives back, which is really what everyone wants to do all the things that they love.
St Vincent's has been on, full display during this pandemic, and I just feel incredibly privileged to have been part of a team that has managed this crisis in an efficient way, in a safe way, but also a very human way. And I feel very privileged to be part of this team.